Could a single cruise ship become the spark for the next global health scare? We've all seen the images: passengers in masks, a sense of urgency, the unsettling familiarity of a world on high alert. It's a scene that, for many, conjures up vivid memories of the early days of COVID-19. But what if I told you that the story unfolding isn't what it seems? What if the fear being manufactured is far more dangerous than the actual threat? Before we dive into the nitty-gritty, if you want to stay on top of everything happening in US politics, hit that subscribe button right now and leave a like. It really helps this channel grow, and it ensures you don't miss crucial updates like this one. Now, let's talk about what's been circulating. We've seen reports and images of passengers leaving a cruise ship, clad in personal protective equipment, prompting immediate comparisons to the COVID-19 pandemic. The implication is clear: a new, deadly virus is on the loose, and we're heading for another lockdown. However, according to health officials, this narrative is fundamentally flawed. They are actively trying to dispel the notion that hantavirus, the illness linked to the situation on this particular cruise ship, is poised to become the next global pandemic. So, what exactly is hantavirus, and why are health authorities so adamant that it's not another COVID-19 waiting to happen? Hantaviruses are a group of viruses that can cause two distinct types of illness in humans. The first is hantavirus pulmonary syndrome, HPS, which is a rare but serious respiratory disease that can be fatal. The second is hemorrhagic fever with renal syndrome, HFRS, which is more common in Europe and Asia and can also be serious. The key thing to understand is how these viruses are typically transmitted. They are primarily spread through contact with rodent droppings, urine, and saliva. Inhalation of virus particles aerosolized from these dried materials is the most common route of infection for HPS. It's not an airborne virus that spreads easily from person to person like influenza or SARS-CoV-2. Health officials emphasize that human-to-human transmission of hantavirus is extremely rare. While there have been a few documented cases, particularly with certain types of hantavirus in South America, it is not the primary mode of spread. For the vast majority of cases, especially those linked to HPS in North America, the exposure comes from the environment encountering infected rodents or their waste in enclosed spaces. This is a critical distinction. COVID-19, as we know, is highly contagious and spreads through respiratory droplets when an infected person coughs, sneezes, or talks. Hantavirus requires a much more specific and often indirect mode of transmission. The cruise ship scenario, while visually alarming, likely involved specific circumstances. Perhaps a particular cabin or area of the ship had rodent exposure, leading to infections among a limited number of individuals. The use of PPE would then be a precautionary measure for those directly interacting with potentially contaminated areas or the affected individuals, rather than a sign of widespread community transmission. Health officials are working to contain any potential localized outbreaks and ensure proper disinfection and rodent control measures are in place on the ship and at the port. What does this all mean? It means we need to be cautious about sensationalized headlines and the tendency to immediately equate any outbreak with the scale and transmissibility of COVID-19. The panic that can arise from such comparisons can be detrimental. It can lead to unnecessary fear, misallocation of resources, and a general erosion of public trust in health guidance. The affected passengers and crew, of course, are the priority, and their well-being is being addressed. But for the broader public, understanding the nuances of transmission is key to assessing the actual risk. Who is affected? In this specific cruise ship situation, it's primarily those who were on board and potentially exposed. Globally, hantavirus is not a widespread pandemic threat. Cases are sporadic and often linked to specific environmental conditions, such as agricultural work, cleaning out buildings that have been uninhabited, or camping in rodent-infested areas. The risk to the general public remains very low, especially in developed countries with effective public health surveillance and rodent control. The possible outcomes here are that health officials will successfully contain any localized infections, provide appropriate treatment to those affected, and implement measures to prevent future occurrences on the ship. The narrative will hopefully shift from impending pandemic to managed public health incident. The danger lies in public perception. If people overreact, it could lead to xenophobia or undue fear of travel, impacting industries and communities. So, what do you think about this? Are we too quick to jump to pandemic conclusions every time we see images of people in masks? Drop your opinion in the comments below. I read every single one. The reality is, while any illness demands respect and proper management, not every health concern is a global catastrophe. Health officials are working diligently to provide clarity and prevent the spread of misinformation. Stay informed, stay vigilant, and trust the science.